So recently we had the pleasure of having Dr. Tonia Cox, pediatrician at CHI Memorial's Pediatric Diagnostic Associates on, talking about your baby and sleep. So this morning she is back to talk about your baby and crying. This is a tough one for every parent and grandparent watching.
It's really tough. Crying is one of the most difficult things for parents to hear. It pulls at your heartstrings, and you know, babies cry for lots of different reasons.
It's amazing too when you're a first-time parent, especially, how it takes only a couple of days, if that, to pick up on the fact that your baby has different cries for different reasons.
For sure. Yeah.
But some of those are healthy for the baby, right?
Yeah. It's important for new parents to realize that crying is normal.
Okay.
Okay? And crying will not hurt your baby. Crying is a way that they can communicate. Sometimes it's communicating a need, like I'm hungry, or I'm uncomfortable with the temperature, or I need to be burped, or I need to change my diaper. So, you know, it can communicate those important things, but crying also serves a purpose for babies to block out sight, sound, situations that might be too intense for them. It's kind of their own little white noise sometimes. And crying is a way of relieving tension for babies.
Really?
Really.
So that's why you were saying that if you're putting your baby to sleep and they cry a little, they're actually kind of crying themselves to sleep, literally.
Right. So it's important that we go through the checklist of everything that our baby needs and attend to all of those needs and make sure that, you know, everything's taken care of. And if you've gone through your list and your baby's fussy and it's been, you know, you have a newborn and it's been longer than an hour and a half or 2 hours since they've had a little nap, they might just need to cry a few minutes to transition into restful sleep.
Okay.
And so the sooner that parents kind of figure that out about their individual babies, because many babies have to cry for a few minutes before they sleep well, the sooner they figure that out, the easier that transition is, and the more that they feel relaxed. And that's really key when it comes to soothing a fussy infant, is trying to stay relaxed ourselves.
As the parent.
As the parent, because babies pick up on our emotions. When we're stressed and anxious, they're stressed and anxious, and they cry more.
Is that why you hear so many of us say it was so much easier with the second baby? Because you just know what you're doing by then?
Absolutely. You know, I've done this before. This is hard, but I can do this.
Right.
That confidence, and therefore that relaxation translates to a much easier second baby for most parents.
So back in the 1990s when my daughter was born, there was a show on TV called Mad About You. And they had a baby on the show, y'all might remember this, and there was a great episode where they were having to get the baby to fall asleep and they couldn't do it, and they sat outside the door and they would count the minutes. Do you know what I'm talking about?
Yeah.
And I remember we tried to do it, and it was the longest 15 minutes of my life.
Absolutely.
So how do you know how long is too long to let your baby cry?
Well, you know, I'm going to give you a couple of tips on soothing measures. So the most effective ways to get a baby to stop crying. So the number one thing is the combination of shushing or white noise combined with bouncing or rhythmic motion. So a lot of new parents are amazed when I can pick up a newborn infant and
we've all done it.
And they stop crying in an instant, and they're like, "Teach me that trick."
Right.
It's really not anything too earth-shattering, but it's a great technique to know, to shush pretty loudly in their ear and bounce them.
Okay.
So for parents of particularly fussy infants, babies that might have colic, it's sometimes a good idea to just go ahead and invest in an exercise ball so you can just sit and bounce them.
Is it imitating the womb or something? Is that the sound?
Well, we don't know precisely, but that it's hypothesized that has a lot to do with the calming nature of that technique. So swaddling, especially for a newborn that's used to being tight and snug, can sometimes be soothing. Going for a walk, car rides. That's one that a lot of parents are like, pull out in a pinch, just pop them in their car seat and go for a drive.
Right.
But white noise is really effective for a lot of babies.
So either a fan or a noisemaker, keep one in the room.
Yeah.
How about being on your tummy? Is that a good thing to walk them on their tummy?
A lot of babies are soothed by that.
I did that a lot.
I call it the super baby, where I kind of hold them like this, and you can massage their tummy. So if their tummy's a little gassy, that can kind of kill two birds with one stone, and you can rock them like that.
Okay.
So it is important to make sure that you've burped your baby. And crying, babies actually swallow air when they cry. So if they've been crying for a few minutes, you may want to try and get another burp out of them, even if they haven't eaten recently.
Okay. And then certainly know that you do know your baby from that first moment he or she is born. They belong to you. So if you think that there's something not quite right, by all means go see your pediatrician.
Oh, absolutely. Absolutely. Listen to your parental intuition and follow those instincts. If your baby's inconsolable, check a rectal temperature. Make sure that they're not too hot or too cold. And if nothing seems to be working and you just feel like something is not right, don't hesitate to call your pediatrician. But it is important to remember that we can't let our normal feelings of being frustrated or even angry at times translate into our actions. We have to control our behavior because the ramifications can be so grave. So a baby should never be jerked, shaken, slammed, or thrown. That can cause brain damage, blindness, or even death for babies. So,
which is why you say always take care of yourself first as the parent. So feel free to even walk away. Keep the baby someplace safe and walk away.
Take a break. If your baby's inconsolable and you feel your blood pressure raising, set them down in a safe place, walk away, call a friend, a family support, take some deep breaths, busy yourself with some chores, or even do a little exercise.
And we've all been there.
Right, we have all been there. So it's important that parents know that crying is normal and there is no perfection. We have to be realistic that babies cry. So the amount of crying that babies do surprises a lot of parents. So it starts to build when they're a couple weeks old. It peaks at 6 weeks. Most six-week-olds are crying anywhere from 3 to 3.5 hours per day. That sounds like a lot. And it is a lot when you're hearing it. But it starts to decrease when they're a couple months old. And by the time they're about 3 or 4 months old, they're crying 1-2 hours a day on average. So parents have to recognize that it's normal, that setting an expectation for perfection when it comes to parenthood is setting yourself up for failure. Because, we have to just take each day and be mindful of the wondrous experience. I mean, it's just so amazing to be a parent, but there is no perfection. We just have to do the best we can, take care of ourselves,
and enjoy each moment as it comes.
Yeah, absolutely.
You can find Dr. Cox 2 different locations, one on Glenwood Avenue, Glenwood Drive, the other Gun Barrel Road, 698-BABY-2229 if you want to give her office a call. We're back after this.